Welcome to QD Clinic. I'm Jack Cush with RheumNow.com. QD Clinic is brought to you by You Got It, RheumNow Live 2021, March 21st, streaming live to you at home. Today's case, it's called, I don't know. I saw a case today, a woman with widespread pain, intermittent pains here, pains there. Been going on for 8, 9, 10 years, and never saw a rheumatologist before. Did go to other practitioners with unsatisfactory responses, unsatisfactory interventions, largely untreated, and now not doing well and wanting an answer. Okay, I'm your guy. In the end, the answer was, I don't know. Meaning it sounded to me like it could be a soft tissue rheumatism story, and it could have been fibromyalgia, and it could have been a sleep disorder, but it's missing a lot of key elements, including, enough tender points or bad sleep or a number of other features that would have cinched the diagnosis, but yet nothing was found. So what do you do when you don't know what really is going on? You can fake it, but the patient's gonna know. I always think it's a great idea to start off by saying what you know from this intervention, this evaluation, and maybe even start with, I don't know what you have, but this is what I do know. Or you could start with, what we know from this evaluation today is what you don't have. Sometimes the patient's greatest satisfaction comes from hearing from you, the expert, that they don't have whatever it is they may be worried about. And you need to find out what they may be worried about early on in the course of the evaluation. Are they worried about them having the disease that their grandmother or their aunt had? Or are they worried about that lab test and the PCP who said, you may have lupus, don't worry about it. Lupus? What do you mean lupus? I'm worried about it because they looked it up on the internet. So telling them what they don't have has great reassurance and great value. And then you can work on the finer details. I think it's important to say what you do know. And I think we often miss the opportunity to say, listen, you've had these complaints for a number of years. If this was a big, bad, ugly disease, cancer, autoimmunity, autoinflammatory syndromes, you've had plenty of opportunity, you and your immune system and your bones and your cartilage, to show the ugly signs of those diseases. And guess what? Here we are today, and none of them are evident. Not evident by the labs, by the x-rays, by the imaging, by your expert exam, your magical fingers, and again, the history that they've revealed to you through careful questioning. So in the end, you have to leave the patient satisfied. Sometimes, as I said, telling them what they don't have is satisfactory. And if they are dissatisfied or still puzzled or whatnot, say, listen, all the big, bad, ugly stuff would have jumped off the table today, and I would have diagnosed you with something that you might be worried about. I'm not doing that, and I'm not in a rush to do that because I'm going to see you back. We're going to do an empiric trial of this and that and see how you do. We may or may not get to further investigations. I think the big mistake here is to say, we're going to do a bunch of labs, and the labs will help us figure it out. Wrong. All your diagnoses are clinical, supported by labs. If you have no clue what it is, don't be relying on labs. Again, labs are going to be done for safety or for reassurance, or if you really think they might have a B27 related disease, by all means, go ahead and order a B27. But don't go fishing for an alternative diagnosis to what you don't know based on labs. You're adding to the problem by doing so. Remember all those consults you got for ANAs that mean nothing? That could be you in the future if you order too many lab tests. This is what I do when I don't know. But I do know I'm going to RheumNow Live March 20 and 21.